Memorial Center's Take Leadership Series. My name is Deidre Teagarden. I'm the Executive Director here at the Nisei Veterans Memorial Center, where our mission is to inspire people to find the hero within themselves through the legacy of our Nisei veterans. We're so thrilled to have all of you with us today as we talk story with Mr. Mike Rembis, the CEO of Maui Health System, and his Chief Strategy Officer, Mr. Jim Diegel. Definitely timely as we know that the vaccine for COVID is being shipped across the nation to our hospitals. So definitely something that we want to talk about today. Take, of course, means bamboo in Japanese for those who have not tuned into some of our other talks. And it's known for its strength and resilience during difficult times. And this whole series was started about 6 months ago at the beginning of COVID, when we wanted to invite leaders from across the state to come on and talk about how we can collectively, as a community, kind of get through this new normal. So we're really thrilled to have our speakers today. Before I introduce the speakers, we do want to let you know that we are taking questions, and there's a little question and answer box at the bottom of your screen. So please feel free to type your questions in as you think of them, and we will get to as many as possible throughout the event, throughout the talk. We also want to thank all of our sponsors that you can see here on this screen. We wouldn't be able to do any of the programs that we do here at the center if it weren't for these very gracious organizations. So please take a moment to look at those and help me thank all of our sponsors. All right. Now, before I introduce our speakers, I wanted to give you a little overview of Maui Health as well. Maui Health, aka Maui Health System, community hospitals and associated clinics affiliated with Kaiser Permanente, includes Maui Memorial Medical Center, Kula Hospital, Lanai Community Hospital and associated clinics, and it serves the people of Maui and Lanai. The facilities under Maui Health employ more than 1,500 Maui County residents, partner with over 460 hospital-based physicians, clinicians, and community-based primary and specialty physicians, and are open to all patients, regardless of health insurance coverage. Maui Health is committed to delivering high-quality, affordable, patient-centered healthcare and improving the health of the community. Maui Health is supported by Kaiser Permanente's industry-leading technology systems, evidence-based medicine, and nationally recognized care quality. And for more information, you can visit mauihealth.org. And with that, it gives me great pleasure to introduce our two speakers today. First, Michael Rembis, Chief Executive Officer. Michael brings more than 35 years of community hospital leadership and hospital operations experience to Maui. He comes to Maui Health System from a successful career in Southern California as an executive in a number of respective health systems. Most recently, he provided regional hospital leadership and management for Memorial Hospital of Gardenia, Community Hospital of Huntington Park, Coast Plaza Hospital, East Los Angeles Doctors Hospital, and Howard University Medical Center in Washington, D.C. Michael's hospital leadership experience also includes holding top positions at Providence St. Joseph Medical Center, Hollywood Presbyterian Medical Center, Riverside Community Hospital, Centinela Freeman Health System, and Eisenhower Medical Center. Michael earned his bachelor's degree in political science from the University of California at Los Angeles and holds a master's degree from the University of Southern California. He has served on the California Hospital Association Board of Directors and Executive Committee, as well as the board of LA Care, one of the largest Medicaid insurance companies in the country. And with him today is also Mr. Jim Diegel. Jim currently serves as the Chief Strategy Officer for Maui Health, a position that reports to the CEO. Jim brings 30 years in senior executive roles in the international, rural, metropolitan, and urban markets in Oregon, Washington, California, physical sciences, and Washington, D.C., Hawaii, and the Marshall Islands. He holds an undergraduate degree in the physical sciences, biochemistry, and a graduate degree in health services administration. He has served on numerous elected and appointed national, state, and local boards, committees, and task forces, including the board of the American Hospital Association, Oregon Regent for ACHE, and governing counselor of the American Public Health Association. Jim has also held elected office in Oregon on a city council and a school board, and has advised organizations in the area of improving community health and addressing the social equity detriments of health. Please help me welcome Mr. Mike Rembis and Mr. Jim Diegel. Gentlemen, aloha and welcome. There you are.
Thank you, Deirdre. Nice to be here.
Yeah, nice to have both of you here. Thank you for taking time out of your schedule for us.
It's a pleasure to be able to talk to everyone and share with you what is happening at Maui Memorial and what's happening in healthcare on Maui right now. Let me just start off, if I could, and tell you a little bit about our experiment here. We are affiliated with Kaiser. Kaiser won the bid to manage all three hospitals on Maui about 3.5 years ago. This is the first time in the country where Kaiser has decided to run hospitals as community hospitals, not as a Kaiser hospital, but as true community hospitals. So Jim and I have never worked for Kaiser before. This is our first experience because they wanted operators that really know the community. So this is the first time in the United States that Kaiser has made a commitment to help a community and maintain their community hospitals and strengthen them. So we're excited. We had all the resources from Kaiser that we need and all the independence of a true community hospital, with our own community board, which includes some of our local doctors and many of our community leaders. So it's a very exciting challenge to do something that's never been done before in the Kaiser system. And we faced our challenges here on Maui. Before I tell you, and Jim tells you a little bit about where the hospital's going, let's talk about where the hospital's at right now. We're very busy. This is not unusual. In the winter months, we get very busy. We have about 180 patients. We have 219 beds, and we are dealing with COVID-19. We're very blessed, though, on Maui. The incidence of COVID-19 pales in comparison to the mainland. We worry every day when we look at the news, the nightly news. When you look at what is happening throughout the country, the surges are huge. Right now, we only have 4 COVID patients in the hospital, and that's about as high as we've been in the last 2 months. We've been very blessed. I think people are listening to the mayor. They're wearing their mask, they're social distancing, they're washing their hands, and so much of COVID is transmitted. And keep in mind, when you're out with your friends and neighbors, 30% of the people that are positive have no symptoms. They have no idea that they have COVID-19. So they feel fine. There's no way that they would know that they're infecting others. That's why the masking is so important. So please continue masking, continue social distancing. What we're seeing right now is a surge throughout the United States. We are seeing the numbers go up on Maui slightly. It's interesting. We keep in contact with the county and the mayor on a daily basis. Most of the increase you're seeing on Maui, the vast majority, has nothing to do with the visitors. It's our friends, our neighbors, our residents letting their guard down, not wearing that mask, not social distancing. A lot of it has to do with Thanksgiving, unfortunately. But we are seeing the numbers start to plateau. We have a lot of confidence that we're not going to see a huge surge, but we are ready if needed. We have plans at Maui Memorial. If need be, we can increase our census almost to 300 beds within our 4 walls. We have also increased the number of ventilators we need. We've increased the number of masks and supplies we need. We're ready for almost any reasonable surge and pray that it doesn't happen. Just so you have confidence too, we test our employees on a rotating basis, especially focusing on those employees that are at high risk, working in the COVID unit, working in the emergency room. And I tell you, PPE and social distancing works. For the last 9 months, we've been dealing with COVID-19. Our staff that's most at risk are those that take care of COVID patients and in the emergency room. And not one of our employees has tested positive because they do what's necessary, wearing the protective clothing, the mask, and taking care of themselves. If we don't take care of ourselves, we can't take care of you. So that is so important. We also, as you know, up in Kula, have some long-term care patients and skilled nursing patients. We test them on a regular basis, and so far, not one of them has turned positive. We also test some long-term patients we have on Lanai on a regular basis, and again, they're all negative. We continue to test. We have tested almost 2,000 employees, some of our employees more than once. We don't let any employee come to work if they have any symptom or they're not feeling well, and we pay them to stay home. We do not want people coming to work sick. So it's real important. If someone has any of the symptoms, they're immediately put on a furlough with pay, and we rather they stay home and not endanger their coworkers and the patients and community we serve. So we've done well. We continue to pray that we don't have a surge. We are ready if there is one, but now the focus has really moved to the vaccine. We also are in contact with the county almost every day and with the CDC, and I can tell you the vaccine is on its way. We don't have a delivery date for Maui yet. Last we were told that it will arrive in Honolulu probably tomorrow. I suspect we will have the virus vaccine here on Maui, and we'll start distributing this week. The first individuals to get the vaccine following CDC guidelines will be healthcare workers. So we've offered to vaccinate all of our healthcare workers, and they're even tiered. Of course, our nurses and the people doing direct care to our patients is first priority, and our physicians. So we will roll out the vaccine probably either Thursday or Friday of this week. And we think that the majority of our staff will take the vaccine. There's a few, much like you and me, that are friends and neighbors that want to wait and see. But I think most healthcare workers understand to protect themselves and to protect the community, getting the vaccine is so important. So that will take place this week. We also know that there'll be continuing distributions of the vaccine on Maui. First just Pfizer, and then the other vaccines as they're approved. After healthcare workers, after our physicians, it'll probably be long-term care residents and those individuals in skilled nursing facilities and their staff as well. After that, it's more than likely going to be those over 65 and those with significant comorbidities or other symptoms that can weaken your immune system. So we're going to follow the CDC guidelines. We're working hand in hand with the County Department of Health. They will be also vaccinating people throughout Maui. We're doing healthcare workers and physicians. The county will be doing the community, and they have a contract. Actually, the federal government has a contract with both CVS and Walgreens to actually vaccinate all our long-term care and skilled nursing patients. So it's really a joint effort between the pharmacies, the county, the Department of Health, and Maui Health to make sure this vaccine gets distributed as quickly as possible. And I want to give a thank you to the University of Hawaii, Maui Community College. They had a huge ultra low freezer, which they were not using, which they've loaned to us. So we can store literally thousands of vaccines at below 70 or 80 degrees. And we have the capacity potentially for the entire island. So what cooperation by everybody on Maui. We feel comfortable that we should have most people who want to be vaccinated by the end of spring, but we're going to be following the guidance of the CDC and the Department of Health. We talk to them every day and we follow their guidance. We have from the beginning. It's so important that we do everything correctly. We're the only hospitals on Maui, and your care, your health is the only thing we're here for, is to make sure that we take care of you and provide the very best care possible. So with that, I'm happy later on to answer any questions about COVID-19, our preparation at all. I thought perhaps we could have Jim talk a little bit about how this is a different hospital than it was when it was a state hospital. These hospitals were state hospitals for almost 60 years. A lot of changes happened in the last 3.5 years. And Jim and I have put together a strategic plan that we'd like to share with you on where the hospital's going. And after Jim talks, I'll share with you some of the things that we're doing right now to improve healthcare on Maui. With that, Jim?
Thanks, Mike. Aloha and good afternoon, everyone. As Mike said, I joined the organization about 1.5 years ago to work with Mike on really envisioning and trying to synthesize our strategic direction for the organization. As a side note, Mike and I had the pleasure of working together about 30 plus years ago. I won't say how many years exactly, Mike. When Mike was a young, successful executive, I did what was called an administrative training, administrative residency program underneath Mike. Went off and had my own career. And then about 5 years ago, we had an opportunity to work together in Washington, D.C. before he came here to Maui. And then, like I said, 18 months ago, Mike invited me to come and work with him as his chief strategy officer. So as Mike said, the Maui Memorial Medical Center, Kula Hospital and Clinics, and Lanai Community Hospital were part of the Maui region of the Hawaii Health Systems Corporation. It was a state-run institution and served the communities well for many decades. And then as the new relationship developed with Kaiser, Mike was brought in to really kind of build a community-based health system and bring his experience and the experience of the rest of the senior team into really taking Maui Health System to the next level. And we focused a lot in the early years turning around the operations. Mike and his team have done an outstanding job of that, reducing the state subsidy with each subsequent year, with the goal in the future of really eventually moving away from that state subsidy and supporting our operations basically on the work that we do every day. But we've been working closely with the board and senior leadership and physician leadership on identifying really a strategic direction for the organization. So one of the things you'll see us do in 2021 is we'll revisit our mission statement, which is really the reason we exist as an organization. And then also update our vision statement, which is where Mike and the board really want to take the organization. Along with that, though, we have begun to move forward in looking at what are those strategic initiatives that we want to focus on. And so we've identified 5 strategic goals. And these goals are where we are going to really focus our attention in activities over the next 3 years. And at the top of the list, of course, is quality and safety. I think any organization in healthcare these days really wants to focus on improving quality outcomes and ensuring we have a safe environment, not only for patients, but also all of our physicians and caregivers. And we know too that financial sustainability, as I mentioned just a minute ago, is really key, as well as partnership with the Maui Health Foundation and the philanthropic role that they play for the organization. But there are 3 other goals that are really, really foundational for us. And the first one is creating a values-based organizational culture. We know that Hawaii is a unique place. We know that Maui is an even more unique island. And we have a mosaic of peoples from all kinds of backgrounds and experiences and transplants onto the island and individuals who have lived here all their lives. And so we want to create a very intentional organizational culture that really marries the best of everything that exists on this island and with individuals. And so we're focusing very much on creating what we call a values-based organizational culture. And over time, you'll begin to hear about that, and you'll hopefully also begin to see exactly what that means for the organization as we move forward. Again, we are very community-based. We are here to improve the health and well-being of all of the citizens and residents of Maui and Lanai, and the visitors and tourists that also come to our island. Another area that's very important to us is how do we enhance partnerships and integration of services? And when we talk about partnerships, we mean both internal partnerships with our caregivers and employees and our physicians on our medical staff, and external partnerships too, which include organizations like the Maui County Department of Health that Mike referenced, partnering with them on how we plan to vaccinate the residents of Maui, and other partnerships out there, because we believe that as a healthcare organization, we need to be in relationship with others in terms of delivering not only healthcare, but human service related projects too. And so we believe as an organization that when we talk about homelessness, that's something we need to be aware of and involved with. When we talk about food insecurity, or we talk about housing and transportation. So expect to see Maui Health partner in a robust way with a variety of partners, both internal to our organization and also in our community as part of our community engagement strategy. And then another area that we're really focusing on specific to Maui Memorial Medical Center is we intend to position ourselves as a regional referral center. Well, what does that mean? Well, a regional referral center is a hospital that not only has all of the general specialties that you are familiar with in most community hospitals, but also has a degree of sophistication and expertise in specialty areas such as cardiovascular surgery or stroke care or advanced orthopedic procedures, and specialty areas like bariatrics and weight reduction, et cetera. And so as Mike will talk about, we're spending a significant amount of our time really recruiting and expanding the capabilities within our medical staff so that Maui Memorial can become more of that referral center where perhaps referrals coming from the Big Island or other locations off Maui can come to us, and we can take care of those patients competently and with high quality. And along with that, part of our strategic goal is to be able to offer programs and services and ensure that there is community confidence in what we do by reducing the outmigration of patients from Maui to either up to Oahu or over on the mainland. We feel that part of our strategic direction is really to ensure that we're focusing on taking care of patients as close to home as possible, that's consistent with what you want to see with a community health system. So Mike, with that, I've teed it up. If you want to take it from here.
Thank you very much, Jim. Let me just share a couple of things with you. We've been recruiting specialists to Maui now for 3.5 years. Well, when I came here 3.5 years ago, it was obvious that we had lost a lot of subspecialty care to Oahu and the mainland. I can say with confidence, there's very little you need to leave Maui for. We can do almost everything that Oahu does, and sometimes, in most cases, as good, if not better. We now have 2 neurosurgeons on this island, not only doing neurosurgery, but spine surgery. We now have a new vascular surgeon on this island. We also do neurointervention, which very few community hospitals do. So you're having a stroke, we can actually remove a blood clot within 20 or 30 minutes if you quickly come to our emergency room. We've also recruited more orthopedic surgeons. We're now replacing hips and knees, and patients are going home that day or the next morning with great outcomes. We are also focusing on cardiac. we've always had 2 cardiac surgeons on this island and 3 interventionalists. There's very little people need to go to Oahu for. And I'm happy to say that now our quality metrics are as good as the hospitals on Oahu. Matter of fact, in U.S. News and World Report, the American Heart Association has identified us as having one of the best heart and stroke programs in the country. The only 2 hospitals in Oahu that's close to us is Queens and Kaiser. We're very proud of that. And we're also proud that when we look at our quality metrics, these are metrics that the United States government uses to judge all hospitals. We are as good or better than all the hospitals in Oahu, and many times better than our national colleagues. So we are focusing, as Jim said, on quality, quality, quality. And to get that quality, we need to make sure we're getting great physicians that have great outcomes. And we've been recruiting. In the last 3.5 years, we've recruited 13 new physicians to Maui, and only 1 has decided to leave. That's pretty good. And we are planning to recruit even more in the next 2 years. We actually have just recruited a brand new infectious disease physician, which will help us with COVID-19. COVID-19 is not going to go away with the vaccine. So we needed to make sure we had the specialty care we need going forward, and a new infectious disease physician will be joining us in February. We also have been really focused on not relying on Oahu or the mainland for healthcare. Believe it or not, 3.5 years ago, we had 200 staff members from the mainland working at the hospital every day. We have it down under 50 now. We have hired every single new Maui grad from the nursing program for the last 3 years, and we're going to continue to do so. My goal is very simple. I want people from Maui taking care of people on Maui. And we need to develop young interest in healthcare, and we need to continue to work with the college to create new skills and new talent so these people can stay on Maui and make a difference right here. We'll be focusing a lot on that. And as Jim said, partnerships, we're working with the Heart Association, the Cancer Society, we're working with all the not-for-profits. We want to be your partner when you're healthy, not just the place you come when you're in acute crisis. If we can keep you healthy, that's good for Maui, and I think it's good for the community. So we really want to be more involved in wellness as well. I think other than that, the other thing I want to share with you, Jim made reference to a regional referral center. We must get more patients on Maui for the specialists. A neurosurgeon, a cardiac surgeon, a joint replacement surgeon needs to have volume. The more they do, the better their skills and the better their outcomes. And the Big Island has no neurosurgeon, no cardiac surgeon, and do very little in joint replacement. So we might have a win-win-win here. We can help the Big Island, our neighbors. We can help our physicians keep their skills and improve their outcomes right here on Maui. And I think we can provide better care to everybody on Maui as a result. So we're going to be focusing on how can we help the neighborhood islands, but more importantly, how does that help us? And in most cases, it's a direct reflection on the outcomes and quality of care here when we do more of these very difficult procedures. So with that, Deidre, I'm happy to answer any questions. I know Jim is too.
Hey, great. Well, thank you very much to start off with, and congratulations on all of the successes and all of the growth you've made over the last 3.5 years. I know I had the pleasure of meeting some of your new surgeons when I was at my other job, and it's really heartening to know also how important you feel those local values are to not only the leadership team at the hospital, but also with your doctors and their families as well. And I just want to give you a kudos on that. And if you want to talk about, you were talking about the values, how you're value centric. If you want to talk a little bit more about that, that would be fantastic, because I know that's something that our organization and the hospital really have in common, are those values.
Well, I'll make a few comments and I'll have Jim add. The most important value for us is community. We want to be connected with this community. We want a sense of community to help us deal with some of the very difficult situations we're having. We have some unbelievable heroes in the hospital right now. They're the healthcare workers. And their unselfishness, their commitment to taking care of each one of us if needed is truly amazing. I am in awe every time I visit the nursing units and talk to our staff. They are risking their literally their health and many times their lives to take care of people on Maui. That kind of commitment and dedication is just awesome. And I can't tell you how privileged it is to work with them and see the work they do every day. So we really want to focus on those values of supporting them and making sure that we are committed to them. They are giving so unselfishness to our community. It is truly amazing. Jim?
I have to unmute myself there. Thanks, Mike. Yeah. Again, I think the key words I just heard Mike talk about were community. And I think as we described being a community-based health system and our commitment to partnerships and our commitment to quality and community engagement in that, it really is all about our community, both the internal community and the external community and people. Mike made reference to the outstanding employees and caregivers we have here and physicians who go above and beyond all the time. So when you think about it, people and community and this commitment to excellence and this just spirit of aloha that is alive and well at Maui Health System and a commitment to compassion are really driving much of what we do. So even though we talked about those 5 topical themes with respect to our strategic plan, they're all supported by the values that Mike made reference to. And you'll recall I mentioned that Mike and the board are going to work again on restating our mission and our vision to get very clear early in 2021. And we're actually going to be spending some time, Mike, doing a survey with our employees to get their feedback on the values that they feel are important that would support our mission and our vision. Because we all know that successful organizations, the culture can eat the strategy, as they say, eat strategy for lunch every day. So we could have the best strategic plan, but if our physicians and employees are not engaged and connected to our work, and we don't have a real healthy culture, strategy never will work at the end of the day. And so that's why Mike has put really the priority on developing a value-based organizational culture going forward.
Right. So
I'll just add that integrity and transparency is real important too, especially during COVID-19.
Mm-hmm.
We are sending out information probably to our employees every single day. We're updating our staff at their homes. We are sharing with the media. We're sharing with the county things that nobody else is sharing in the country. We actually share on a regular basis with our employees how many COVID patients we have, and we thank them for every single thing they're doing. And if we have issues, we share them with them and work through them with them. Being transparent, honest, and having an institution of integrity, especially we've learned during COVID-19, nothing is more important than being in strict communication with our workforce each and every day. And one of the things I've insisted is that we do rounds. I walk through the hospital with the COVID units. We want to hear our employees. We want to make sure we're meeting their needs because they have to meet your needs. And that is so important to us. But as Jim said, I felt we needed to undertake a true reevaluation of all of our values, our goals, and our mission. And our board of trustees will be doing that. But it starts with our employees. We're surveying them in the next few months. And then we're going to our board to make sure that we're in alignment with our employees, with our governing board, and with the community we serve.
You know, and that's, we had spoken earlier about the transparency, and of course there were some growing pains earlier in this year at the start of COVID-19. There was some issues up at the hospital with the employees, but I will say that you were seemed to be very upfront about things, but I don't know if you want to just address that for some of the viewers.
Oh, sure. Yeah, the first surge took place probably in March and April. We, like every hospital in the country, probably wasn't prepared for the COVID-19 pandemic when it first hit. And we were following CDC guidelines, and things were changing so fast. Many of our employees were upset during the initial few weeks because they weren't all allowed to wear masks because the CDC said there was no reason to wear a mask. Hard to believe that now, but we actually insisted on all of our employees wearing masks and provided for them probably a week or two before the CDC recommended it. But our employees wanted it done day one. And the only reason we didn't do it day one, we didn't know if we had enough PPE. I mean, we truly had very little supplies, and the projections we saw for the surge would have wiped out the entire supply we had it been distributed before the CDC recommended it. So we actually, within 1 week, decided to take the risk and distribute it, and we never had the surge that was predicted. But we have followed CDC guidelines, and in most cases have been ahead of the CDC guidelines, as we were with masking. But this has changed so dramatically. We have, since March, when we insisted on everybody wearing masks, provided masking and PPE to every single employee. As a matter of fact, no employee can walk into our hospital, no patient, volunteer, physician can walk into our hospital since March without wearing a mask. That's just absolutely essential, and I don't see that ending for the next year or two. We're going to continue demanding masks. At first, we probably did not share everything that was going on in the hospital because nobody else in the country was sharing it. We learned a lesson there. We now do communications out to our employees 2, 3, 4, 5 times a week. Whenever there's a change in our policy, a change in the status of our patients, we share it with our employees. And I know that it gets shared on social media, but it's important that we be completely transparent. If one thing I learned in the first couple of weeks of COVID-19 is you can't share enough. Can't share enough with your own workforce. You can't share enough with the community. So I will say that the first couple of weeks, we were a bit taken back. I think most hospitals were. No excuse for it, though. We quickly improved our communication. We have our new communications director. We are sending out communications all the time, and we talk to the mayor and the Department of Health almost on a daily basis now and share with them whatever they would like.
Well, definitely lessons learned, and being able to admit that maybe it could have been better, and then making it better is always a good thing. We have a couple of questions here. One is, it's about COVID. If people get the vaccine, are they still going to need to be tested if they want to travel or, even just, going about in town?
That's a great question. I really do not know the answer. Maybe Jim does. This is evolving so quickly. Jim, do you know?
Mike, my understanding is the testing requirements that states or communities have will continue even after the vaccination process starts, because we have to remember it's going to take at least 6 months to a year to get to the vaccination levels where we can actually measure if it's made a discernible difference. So, Mike, I think everything's going to stay in place. And remember, even if you do get the vaccine, the recommendations are you continue to wear the mask, just like everyone else does. So, Mike, you had mentioned last week in a meeting that, it's expected that we will likely see mask requirements through the end of 2022 before things really let up.
Yes, and I know without question, we've been told that even with the vaccine, everyone needs to wear a mask because they're not quite sure. You may not get sick and you may not get the virus, but you may be able to transmit it. So until there's more known, nothing's really going to change. And masking, the worst thing that could happen is people get the vaccine and stop wearing a mask.
Agreed.
Everybody must continue social distancing and wearing a mask.
So you've alluded to this a little bit, but I mean, really, is COVID-19 anything like you've seen before in your years of medical industry?
No, I've been in this business for over 40 years. HIV was a scare for the healthcare workers and for patients, but it was never as large and as far-reaching as this pandemic. There's nothing that in our lifetimes that will come close to this. It has changed so much in our society, how we care for patients. It has had a profound impact on every single staff member, every physician. I've never seen anything like this.
Yep. And Deirdre, I'd echo with what Mike mentioned. You know, I think in our careers, in addition to HIV, we've seen SARS, we've seen MERS, we've seen H1N1. None of which came even close to the pandemic. I think the only thing that created a potential scare was the Ebola virus, right? About 7-8 years ago when that came up because of the virulent nature of it. But this nation never really experienced an outbreak in any appreciable manner. But like Mike said, I've never seen anything like this. I'm not sure we'll ever see anything like this for quite a while again, but you just never know.
Right. Pivoting away from COVID, we have a question about the status of the cardiology intervention program that has provided stents in the past. Can you give us a little update on that?
Yes, we still have 3 interventional cardiologists here doing a great job. We did lose our primary cardiac surgeon. He took an offer off island. It was an opportunity for him. So we have a search committee that's set up, and we've been interviewing a number of candidates to replace him as our head cardiac surgeon. Meanwhile, we have 4 outstanding physicians who rotate through Maui with amazing outcomes. We've never stopped doing cardiac surgery. We've had great outcomes, but we need a leader. And our search committee, made up of some of our board members, some of our physicians, have interviewed 4 cardiac surgeons to date. Actually, we meet tomorrow morning at 8 o'clock and meeting another surgeon. And I hope in the next few months to have identified a leader of our cardiac surgical program. But the community should feel very comfortable. Right now, we have an excellent group of cardiac surgeons, some from university settings, that are doing a great job until we find that new cardiac surgeon.
Great. Someone is writing in about the hospital foundation. Can you talk a little bit about the foundation, its role, and exactly who it is, what it is, how people can get involved?
Well, Maui Health Foundation has been around for a long time, but since Kaiser took over the hospitals, we've put a lot of effort to making sure that they are growing and getting the support they need. We can't do everything without them. As Jim mentioned, we still get a subsidy from the state, which goes away in 5 years. When we took over, these hospitals were losing millions of dollars a year, and the state agreed they would help us out for a short period. And so we must be independently, financially able to continue without the subsidy. And the state subsidy isn't enough to do everything we need to do. So the foundation and their hard work of raising money is going to make a difference on this island. It already has made a difference. The best example I can give you is 2 years ago, we had no neurosurgeons on the island. We did not make any money that year. We fortunately had the state subsidy, and I was able to recruit 2 outstanding neurosurgeons. The problem is they needed new equipment to do neurosurgery and spine surgery, and we didn't have the funds to do it. Our foundation came up with $2 million so these neurosurgeons, day one, could start making an impact on this island and provide the care they wanted to provide. We could not have done that without our foundation. So I have to tell you, the foundation is critical to our success. It's critical to making sure we have the resources needed to provide the care. Without them, it will take us longer. With them, we're going to see some amazing things happen much sooner. Our foundation, if you're interested, go on Maui Health Foundation. They have their own website. They have their own board. They're independent. They decide what they want to use their funds for. We identify for them every year where there are needs, and they decide what areas they want to provide assistance to. The neurosurgery was critical. Right now, they're trying to raise enough money to help us with a chest pain center in the emergency room, an area in the emergency room where people with chest pain can be immediately evaluated in the ED, even have a stress test, and identify whether they have a cardiac problem or whether they can be discharged instead of going upstairs, waiting a day or two to have a lot of tests run. We're going to be able to evaluate them in hours. And to do that, we need more space, we need more equipment, and the foundation's coming to the table to help us do that. It would have started already had the pandemic not been here. So a lot of our construction projects and dreams have been delayed a little bit. We're starting to move forward now, but it was real hard to do a lot of changes in the middle of the COVID-19.
Talking about stress, do you see a lot more people coming to the hospital right now with more stress-related conditions? What do you see an influx of during this pandemic?
Well, believe it or not, what we're seeing is a lot of very sick patients. Our hospital had over 200 patients last week, and there was only 2 COVID patients in. The hospital is not full of COVID. We're full of community members that just need healthcare. And we're seeing the whole gamut, everything from congestive heart failure to pneumonia to people having babies, replacing their hips and knees. The one thing I must stress, if you need to come to the hospital, please do. It's probably the safest place on the island. No one can, we don't allow visitors. We can't because of COVID. The emergency room's never had a positive case. Do not delay care. It is safe in the hospital. We have seen horror stories where someone has a stroke and they come to us a day later. That is such a tragedy. If they come to us right away, we can make a difference and stop them from having any deficits. Do not delay care. The hospital is safe. We don't allow anyone to come in without getting a temperature checks, reviewing their symptoms. As I said, no one comes in if they're sick. No visitors are allowed, with the exception of if you're having a baby, you can have one person come in when you're having that child. If children are admitted, one parent, the same parent, but they all have to be tested as well. And we do allow an occasional visit for end of life, but we have to protect the hospital and keep it as safe as possible.
I think that's a really good point because, you hear people saying, oh, I don't want to go to the hospital right now, or I shouldn't go to the hospital because we need to keep those beds open for COVID. So it's really reassuring to hear you say, no, indeed, if you need the hospital, come to the hospital. For some reason, people are thinking maybe they should wait.
No, in my opinion, the hospital is safer than Costco or any other retail in the island. We're testing our employees on a daily basis. We're making sure that no one can come in who's sick. We are doing everything we want this to be the safest place on the island, the safest place it can be for you and me.
Jim, you were talking earlier about your strategic plan and how the culture, the local Hawaiian mixed culture is very important to the hospital moving forward. If there is someone who wants to get involved, are you doing a Zoom task force, or is there a way that people can offer suggestions on what they would like to see at the hospital? Is there any mechanism for that?
We don't have a formal mechanism in place right now, and Mike can also address this too, Mike, a little bit. We could talk a little bit about Holoi Mua and what that means for the organization. But again, when you're talking about becoming engaged with your community, that's a very proactive and intentional way in which the organization shows up into the community. And so by virtue of some of those strategies, you're automatically inviting interaction and input from others around how your organization operates and what you're attempting to do. Part of our thinking with our strategic planning process going forward is how do we, on a very routine basis, connect with the community to make sure that we're also moving in the direction that the community feels that they can sync up with, that they resonate with along those lines. So I think there are, Deirdre, there are multiple touch points that we can interact with the community. And I can tell you the robust nature of our workforce here is so representative of this island that we're feeling that we are getting the perspectives around culture and traditions and customs, et cetera, that helps inform our work around creating a very intentional culture. And that is a very key priority for the organization this year, as Mike has mentioned.
And I'll just add that one of the things I'm a strong believer in, my entire executive team is on the board of as many community organizations as possible. We need to be out in the community involved, whether it's in the churches or the civic organizations, the chamber, whatever our staff would like. I want them in the community, involved and bringing perspective to us, and that will continue. And Jim and I will be looking at other ways to get the community more involved, but doing what we're doing right now is important to us. Partnering with your organization is key. We need to get feedback from you. Deidre, it never stops picking up the phone if there's something Jim and I need to know. That is so important to us that we get feedback from the community. And the only way we can do that is by being out there and connected with you. And we're going to continue doing that. And if you have thoughts, let Deidre know. And we want to be part of the community in a very meaningful, deep way.
Thank you. Let's talk a little bit about the philanthropic work that the hospital does. You do a lot within the community that people, if they're not involved in that specific organization or that specific event, might not know about. But talk a little bit about your philanthropic efforts.
Well, we try to reach out in the community and help wherever we can. We've made donations to the American Cancer Society to help keep people on Maui. We've been involved with the Heart Association, Alzheimer's group as well. We've actually made some donations to about a dozen other organizations, and we provided a lot of food during COVID-19. We just did at Thanksgiving. We gave all of our staff a turkey, but we also made sure we had turkeys for all the homeless shelters and some of the churches that feed the homeless on the island as well. As Jim said, we're part of this community. So if there's homeless people out there, we need to be aware of that and do what we can to help those organizations. We're not an expert in dealing with the homeless, but we know organizations that are, and if we can help them, help others. And in most cases, that's what we're doing. We're helping other not-for-profits make a difference in the health and well-being of the people on Maui. Sometimes we'll do it ourselves, and sometimes it's just better to go to the people that have the resources and the expertise and give them some help to reach out and help the community.
Thank you. We are gently coming to the end of our hour, but I want to give you two gentlemen the last word. I'm going to let everybody else know who's watching today. Thank you for joining us. And if you do have questions, you didn't get something answered, you want to send in a comment to either Mike or Jim, please feel free to email us here at the Nisei Center, the same email that you used to connect to the webinar today, and we'll get that to them. And a reminder that we have 2 more events left before the end of the year. Tomorrow, we're speaking with the former managing director of the Maui News, the former managing editor of the Maui News, Mr. Lee Imada. And then on Saturday at 1:30, our final and afternoon with the author for 2020 will be with Pamela Rotner Sakamoto, who wrote the very compelling book, Midnight in Broad Daylight. Both of these events are listed on our website at nvmc.org, and you can sign up you can sign up there. This event is being recorded and will also be available on our YouTube channel in about 2 weeks. So feel free to check out our Nisei Veterans Memorial Center YouTube channel, this talk, as well as some other talks that we have done these past several months. Before I go back to you, Mike and Jim, Dr. Peter Galpin is writing in to say hello. He was a former board member of ours, beloved board member. He is now has moved away, but he wanted to say hello.
Well, I will tell you, we miss Peter. He was truly one of those heroes and angels here. He did so much on his own for many years. He was on call almost every single day, taking care of patients on Maui. And we miss Peter. We wish him and his family the very best, and hope they come back and say hello occasionally. But boy, do we miss him, and he made a real difference on this island. Deidre, let me just end by leaving a really important message. Maui Memorial is your hospital. These are community hospitals. They're your community hospitals. They're not Kaiser. They're not part of any large system. They are truly a community hospital run by a community board. They are your hospitals. Maui Memorial is your hospital, as is Kula and Lanai. And our commitment is to provide the best care. I don't want anyone to have to leave Maui for healthcare. And we're going to do everything we can to make sure people feel comfortable getting their health care here. This is where I'm going to go get my health care. And we have to make sure we take good care of our friends, our neighbors, our relatives. Maui is your hospital. And if there's things we need to do better, let Deidre know, let us know. You can email us. Hearing back from you and the community is what makes us stronger. Thank you. Jim, anything you want to add?
Oh, I can't top that, Mike. So I think that's the best way to end.
All right. Well, we want to thank you both again for taking time from your schedules to be with us today, for being transparent and sharing with us all of that is happening with the Maui Health System. And all of you, again, thank you very much for being with us today. Until next time, we wish you a hui hou, be well, stay safe, and happy holidays. Aloha.
Aloha.
Yep.